I serve the board to help it accomplish its mission of empowering communities and training individuals and finding answers to support health. I have a background as a health services researcher and training in epidemiology, and I also have done work that's very policy relevant in the diabetes area, and so it's an exciting opportunity for me to see those skills translated into an area of environmental and community health. Statistics is a science that helps us to determine whether differences that we see in populations and in outcomes are just due to chance, or whether there really is something different about a group or a community from the surrounding area. So for instance, if we saw higher levels of income in a couple of houses, is that really because this neighborhood is more affluent, or is it just by chance? In the area of disease, we want to use statistics because we want to identify areas where disease rates may be higher. Areas with higher disease rates are important for a number of reasons. Obviously, people who drive health policy may need to know this in order to provide adequate services. But at a more fundamental level, seeing a pocket where there's more disease may lead us to clues as to what is causing that disease. There may be a link between something that's happening in that neighborhood or environment and the disease. Statistics will tell us whether that higher rate of disease that appears to be clustered in one community is just because of chance alone, or whether there really is something different. In order to determine that, one needs to have what a statistician would call adequate sample size. Let me give you an example. If I went into a high school in Parry Sound and pulled 5 kids out of a classroom and they were all boys, should I be horrified knowing that Parry Sound is exercising sex selection in childhood and only boys are surviving to adolescence? No one would think that. 5 isn't a big enough sample size. You wouldn't be shocked if you flipped a coin and 5 times in a row got heads. Now you might be a little surprised if you went into the classroom and all 25 students were boys, but there might be an explanation. Maybe it's a content subject area that boys gravitate towards. But if in the entire school of 1,200 students, 80% were boys, you think something is going on here. Girls aren't being allowed to pursue higher education. There are less girls for some reason. It would prompt you to look for a cause. Statistics is what tells us when is that difference. 100% boys in the 5 students case, or 70% boys in the whole school case. When is that important? When is it meaningful? Or when do we think it's probably just chance? In order to get valid statistics then, one of the important things is having enough sample size, having enough cases, and then also analyzing those cases in the context of everything else that is going on. In the school example, we didn't necessarily get concerned about the classroom full of boys because the explanation might be boys gravitating toward a particular subject area. We might not be concerned about a particular illness in terms of policy if it's an illness that runs in families and the community all exists of 2 or 3 family groups who are at risk. So we want to not ignore the information we already know, but we want to see, is there beyond the things that we know that should be driving that difference? Does there still appear to be a difference that is statistically different? Now, governments take responsibility for gathering that kind of information, and agencies like the Public Health Agency of Canada will regularly gather statistics on rates of illnesses like cancer, lung disease, heart disease, diabetes, and tabulate those. They tend to do that at a larger community level. And just like if you took a picture and then tried with a camera and tried to zone in on a narrow spot, there wouldn't be enough pixels to really distinguish which pair of earrings was I wearing that day. When you look at the whole area, you get lots of information. You can see all the people who were there that day. But when you would try and narrow in on a narrow spot, there isn't enough information. In the case of a picture, it's not enough pixels. If we tried to look at cancer statistics for small communities, we would run into the same problem. So the health agencies at a federal level or a provincial level who collect those statistics, collect them at a level that don't give us enough granularity. There are not enough pixels for us to be sure what is really happening in a small community. But environmental differences may actually be quite different from one small community to another, and so it's important to know. If there is a small community that is affected by an environmental problem, then when it gets averaged out over the larger community at the level that the federal agencies are measuring, it would disappear. So if you were looking at the boys in the school example, you would see that there's one classroom that was all boys, 25 boys in that one school. But if you measure at the level of the whole school, you don't see an excess of boys, because that 25 students in the classroom, all boys, gets washed out in the entire population of 1,200 students in the school. Similarly, if there was a pocket of emphysema in one community, and you couldn't measure that rate, all you could measure is the larger community, you would never see that pocket of increased rate of disease without going into that community, without going into that classroom and actually measuring what's going on there. I mentioned that the federal agencies collect information on a variety of diseases in order to drive public policy. They want to know where are more resources going to be needed. But if there is a problem in a small community and they don't have data that's granular enough, they will never respond to that issue. And so it's an issue from a policy level, both in terms of getting adequate resources to manage a health issue that may be arising locally, but also, again, to go back to, is there a root cause in that community that isn't explained by genetic risk factors because of a clustering of families or ethnicities? You might guess from the word epidemiology that it's connected to epidemics. Epidemiology is a science that looks at the connection between outcomes, health outcomes, and exposures. And so when people were plagued with epidemics in previous centuries, there was a desire to understand what were the causes, what were the exposures that led people to become sick in an epidemic. One of the revered fathers of epidemiology is John Snow. He was a doctor in London, England in the mid-19th century. At that time there were epidemics of cholera going through London, England, and thousands and thousands and thousands of people died. He was an astute observer, and he noticed when he was making his house calls that the cases seemed to be clustered, almost in circular patterns. And he continued his observations and he tried to figure out what's at the center of the circle, what's drawing those cases together. And he discovered in the center of one of the circles, where there was a very high number of cases, it was a well where everyone went to get their water. John Snow wasn't really able to get the local authorities excited about it, or nor even the population. I think people's understanding of bacteria causing disease and bacteria living in water was pretty limited. So he went and locked the well, and the number of cholera cases dropped dramatically. He took action based on local information that he had observed and linked to a disease outcome, and he created the cure by putting the lock on the well. Epidemiology is a science that really tries to understand the link between exposures and outcomes. Often we'll take an outcome for instance like emphysema. Before we knew that smoking was a major cause of emphysema, we would take a bunch of people who had emphysema and a bunch who didn't, and try and look at all the exposures they had that might have caused that. A disease like emphysema occurs over many years, and so you have to really look back in time and understand what those exposures were. A disease like food poisoning is not so difficult. You can remember the restaurants you ate at and the potato salad at the office picnic that you ate, because it's only a couple of days. But for some chronic diseases, one has to look back over a longer period of time, and one has to consider many potential players: occupational exposures, environmental exposures, food exposures, things that you weren't exposed to, lack of fluoride in the water. Put all those pieces together and try and create a picture to understand what's different in the people who have the disease and those who don't have the disease, in order to identify what is the culprit. Many chronic diseases have a number of causes. Heart disease, for instance, is caused by genetics, it's caused by smoking, it's caused by high-fat diets, it's caused by high blood pressure. And so you have to consider, if there's more heart disease in a particular area, is it just that more people smoke there, or is there an additional factor that's acting here? So it's complex, and the statistical methods that are applied are also complex, but it allows us to confidently say that yes, the rate of disease is higher here, and it appears to be associated with this particular exposure. That's important because those kinds of facts really can drive policy. Policymakers have trouble knowing how to respond to an individual story. I'm affected by this, help me. If they don't see that there's something happening at a larger level that they can actually act on by changing policy. And so epidemiology really can create the numbers that can drive policy decisions and choices to improve health.